Hi, my name is Maria Valdez.
My name is Toral Patel.
And we're from the Summer Institute on Medical Ignorance Research Program. Today, we'll be giving a talk on encephalitis lethargica. Encephalitis lethargica is known as a sleepy sickness. It's very rare in today's society. There was an epidemic back in the 1970s, and it hit us in the 1980s when all the patients had no treatment, and still to this date, there's no treatment. Today, we're going to be giving a talk of the epidemiology of it, the researches to this date, and the researches before, as well as giving you some resources at the end in case you want to know more about this very rare sleepy sickness, as we call it. Now, let's move on to our next slide. So on this MRI, on your left side, you're going to be seeing a normal MRI. If you notice, this region, which is this region, on that side is the basal ganglia. This region on this side, it's normal. It's not inflamed. It's correct white and gray matter. On this one, though, this is somebody that has encephalitis lethargica or lethargy. And you'll notice that in this region right here, as well as the two other slides, it's inflamed. And what happens that the physiology of that is the basal ganglia contains the striatum, as well as it's close to the midbrain, and it is known to produce dopamine. But to produce dopamine, you need to go through various steps in order to get it produced, neurotransmitters and chemicals. In this case, what happens is the dopamine is suppressed. So the acetylcholine, which is the one that's in charge of being able to produce GABA receptors, which the GABA receptors are the ones that help for our movement, are not being balanced correctly. So we have an overreactive of acetylcholine while the dopamine is suppressed and the GABA receptors are not getting produced right, causing bradykinesia, dystonia, and all those things similar to what you see in Parkinson's. Not essential tremors, but in Parkinson's, which is two different diagnoses. And so you can see it's inflamed. There's usually also more white matter than gray matter in the slides. Still to this date, this isn't a form of diagnosing it. It's still just a form to help you with it. So in our next slide, we're going to speak about the epidemiology, and my partner will give a little bit of talk about that. Encephalitis lethargica started in around 1580, though it was not considered a actual neurodegenerative disease. And it started in Europe and then transferred over to North America at around 1900s. In 1580, the encephalitis lethargica was first seen in the Tübingen outbreak over there in Europe, also known as the Schlafenkeit epidemic, and it had very similar symptoms that today we consider the symptoms, like bradykinesia, fever. They actually called it fevers comatosa because some of them would actually end up in a coma-like state. So now then in the 1673-75, it was passed on into London. And in London, the von Economo was the one who declared it officially a neurodisease. And then from there on, they were doing more investigation and thought that maybe a sequela to it could be the Streptococcus bacteria. But they realized after several studies that that wasn't really the case. So once it then went to North America in the 1918s, many researchers were contemplating that it was just bad hygiene due to the World War I and Hitler. As we know, that wasn't hygiene whatsoever. So right now, to this date, we really don't know much facts about it. So it's still being very well scrutinized.
So moving on with the factors of EL. The factors of EL actually play a very big role in the epidemiology of encephalitis lethargica, as it actually explains how EL became infectious and how it spread around the globe. So to begin with, EL was thought of as a sequela, which is a condition that is a consequence of the previous condition. And in this case, EL was thought of as a sequela to infectious diseases such as streptococcus, measles, and scarlet fever. Specifically, it was thought that the neural damage caused by EL was a direct effect of the influenza that had been spreading globally. There are many arguments that make this connection valid. For example, one of the major arguments that was used by von Economo was actually his belief that the influenza had, quote, pave the way for the assumed virus of EL.
What my partner was talking about before was the researches that were done back in the 1700s and in the 1920s with von Economou, which was the one that, as she had said earlier, the one that discovered Encephalitis Lethargica, which we'll be saying as EL throughout the whole presentation. Encephalitis, in this research, it was done in 2003 in London and in Europe, several places over there. And what they wanted to see is if the streptococcus, which is the bacteria they suspect is in Encephalitis lethargica, which actually causes strep throat, but don't go home with strep throat thinking you'll get encephalitis. It's very rare. And they were trying to see if the streptococcus was inside the basal ganglia of patients that had lethargy, tremors, sleepy sickness, as they would call it, encephalitis. And they used 4 controls. Those 4 controls, 2 of them were on human, 2 of them were on rats. The Western immunoblotting as well as autoantigens, all of those 4 actually do the same thing. They're trying to find if the autoantigen, if the antibodies can find the antigens in the tissue. So what they did is they grabbed 2 brain tissues and they used 2 brain tissues of 2 rats with 2 different methods each. And they used that to compare it with the other patient, with the 20 patients they used. The 20 patients were injected with a serum, and that serum actually contains the streptococcus. And they wanted to see if that antigen that they found in the controls was in the basal ganglia. And all the patients, there was 20 patients, all of them presented with lethargy and very similar symptoms, some tremors, bradykinesia, all those symptoms. There was only 2. One had high-functioning autism and one had Down syndrome. Despite of these two diagnoses, this had no difference in them whatsoever.
The risk factors and complications for patients suffering from EL include many short-term and long-term complications which can alter their lifestyles. For example, they could experience complications ranging from a coma, paralysis, motor delay, as well as speech impairment. And these are actually all due to the neurological damage that occurs because of EL. Now, the question that really resides is how the individuals can be tested for this condition. So moving on with the test and diagnosis, unfortunately, there are not many tests to help with the diagnosis of EL. Even in today's modern society with all the medical technology that has been developed, EL is very hard to diagnose because of its generic symptoms at the beginning. Brain imaging, a spinal tap, which includes the lumbar puncture, electroencephalogram, which is also known as the EEG, and also taking blood and urine samples are only few of the diagnosis tests that can be used to uncover EL. However, these tests are available to patients. They are only symptom-based, so they are very limited. So previously, as I was talking about, tests and diagnosis, they rely on looking at the symptoms of the patient. Now, moving on with treatment, it's sort of the same thing. So many symptoms experienced by the patients are mistaken as being flu symptoms. Symptoms such as high fevers, colds, headaches, and even just having upset stomachs. They will first experience that and maybe go to the doctor. And treatment for that includes just simple generic treatment such as getting bed rest, getting plenty of fluids, taking anti-inflammatory drugs in case anything is inflamed in the body, and even taking antiviral drugs if there's a virus detected in the body. However, for more serious symptoms that patients are experiencing, supportive care may be provided, such as a breathing assistance machine, intravenous fluids, and just taking just more anti-inflammatory drugs and anticonvulsing medications, which are of that higher prescription to help relieve those symptoms. One of the most important treatment options that was developed back in the day is known as L-DOPA. And although L-DOPA is not used to this day anymore to treat EL, it has provided a great advance in research for encephalitis lethargica. This is actually a case in Parkinson's disease, but this can also occur in a patient with EL. And what it's showing is that the dopamine level is not balanced with the acetylcholine level.
And this actually causes the GABA receptors to send the incorrect amount of receptors in the brain, which once again can be very dangerous. And this all occurs, like I said before, the acetylcholine when it is joined with the synaptic cleft and the synapse. This is just one specific symptom and case of encephalitis lethargica.
Encephalitis lethargica, as my partner said, is very rare. It's so rare, it's actually considered in the section of the pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections.
So prevention techniques, there are not many prevention techniques available for anyone in the world to prevent encephalitis lethargica. Because this condition is so rare in our modern society today, the only tips that they give us or the patients is just to practice general good hygiene or to get vaccinations. And although that these tips have been given, there hasn't been a study or anything that has shown that these prevention techniques have decreased the amount of cases of encephalitis lethargica. And hopefully in the future, with our advancing modern technology, we will be able to find prevention before the symptoms experienced by encephalitis lethargica patients get harmed.
So in conclusion, what our message pretty much is encephalitis lethargica, it's known to be infectious. It is very rare still to this day and more now. It's something that isn't really studied because it's something that really isn't given cases of. Encephalitis lethargica, there's no, like my partner said, there's no real prevention, just stay clean, wash your hands, and there's many people that have tried other things. They've tried, for example, taking GABA. If you go to the store, to Walmart, you'll see that there's GABA pills that you can take, and those GABA pills actually can't even cross your blood barrier, so they actually do nothing to your brain. L-DOPA, sometimes it's been used. In the 2003 research I spoke about, it was used, but it's not used as much, only for Parkinson's. So just use the resources. If you know anybody, if you suspect anything, use the resources we have mentioned before. And thank you very much for letting us give you this talk.
Thank you.